What's going on, everyone? Happy Thursday. Hopefully everyone is doing well, staying safe, healthy, having a great day so far. Welcome back to my channel. If you had to take a COVID test or a flu test, I hope you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Thursday edition of the Virus Update for Thursday, May 1st, 2025. That's right, we're moving right along here. We're in May now. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there. Things are constantly changing with these viruses all the time. New cases, new studies, new data, new waves of these viruses, deaths. Yeah, there's a lot of moving parts. And you need someone who gives you a report on what's going on with these viruses. That's where I come into play. I do this almost every day. We have missed a few days in the past. But hey, I am here to tell you what's going on and inform you of when the next wave of COVID, flu, measles, or whatever virus is coming. Want to stay informed? Just subscribe down below. Help me reach my goal of 10,000 subscribers by the end of this year. Hit that notification bell. Share this video with anyone you know. And of course, leave your comments in our growing comments section down below. Join the community. Got something to say? Something that's on your mind? Say it down below. Alrighty, we do have a few stories today. We do have a spring and summer reminder. You know, it's starting to get warmer here in the United States. Other parts of the world, it's starting to get colder. But here in the United States, it's starting to get warmer. You're thinking about outdoors more. And if you're thinking about outdoors, maybe you're thinking of gardening, you're thinking of hiking, walks. Well, there's something that may accompany you with that, and that is ticks. Yes, we got to talk about that today. We do have an update from the UK. We'll take a look at some things in the United States, take a look at a couple wastewater sites, and we do have some new data from CJS. But first, we have to start off with measles. This is rather concerning. Chicago area now reports 2 measles cases confirmed, one at O'Hare Airport. This is the first 2 of the season in Cook County, which is where Chicago is, up in that area. 2 cases of measles have been reported in Cook County, according to the Chicago Department of Public Health. And Cook County Department of Public Health officials said one of those cases were detected in an adult who is a suburban Cook County resident whose vaccination status is unknown. The person received care at a local hospital on April 28th and has since been quickly isolated. The other case was identified in an adult Chicago resident who had recently traveled internationally through O'Hare International Airport in early April and had received 1 prior dose of MMR vaccine, according to officials. The majority of the cases have been unvaccinated or unknown, but we are seeing more of these 1 dose or maybe fully vaccinated cases start to pop up, and that's telling me that overall, not just in Chicago, not just in the United States, all around the world, I think there are a lot of missed cases, and there are more cases than we know about. I mean, in order for there to be vaccinated, which we know is not very common, there's got to be a lot more cases. But maybe there's more to the picture. Maybe there's something we don't know about. Could COVID worn down immune systems? You know, people who have had COVID multiple times, could that be a part of the equation? Have these people had COVID multiple times? I would love to know. If all these fully vaccinated cases, how many times have they had COVID? Does that have something to do with it, or is it something else? I don't know. But it's something we continue to keep an eye on because we've been seeing a few fully vaccinated or 1 dose vaccinated cases. Moving on up to Canada now, to Ontario, where they are reporting 223 new cases of measles in the last week. Yeah, the number of measles cases there now is over, I believe it's almost to 1,000 now. So, yeah, the number of measles cases there, it just continues to go up. It is getting rather concerning how many cases they are doing up here. Here in the United States, I'm going to say this, Robert F. Kennedy Jr. was on News Nation last night. They had a town hall meeting, and one of the things he said was that the measles outbreak is starting to slow here in the United States. I don't know. Let's give it a few more weeks to see if that's actually true. Texas, yeah, the number of new cases with the updates from Texas has not been as large, but you know what? They're going to have a new update again tomorrow. Who's to say it doesn't come in higher once again? And also, like I said, I think we're missing some cases, especially since some states, such as Canada, not Canada, Kansas, Kansas. Canada is not a state. Kansas. It's going to make it harder for mitigation to actually happen because something about they don't want to do quarantine or something, some legislation. It's ridiculous. So I'm not going to get into the political aspect of measles, but some people have unfortunately turned it into a political thing. All right, moving on. Long COVID has unique symptoms. Persistence not seen in flu, pneumonia, research suggests. This is very true. I mean, we're not going to read the whole thing, but there's a whole bunch of things that are happening with long COVID. Long COVID has over 200 different symptoms. That's more than there are with the flu. And the most common symptoms resisting beyond 4 weeks in this study, beyond 4 weeks post-infection among COVID-19 patients were fatigue, shortness of breath, joint pain, and among flu patients, the most common symptoms were joint pain, fatigue, cough. In the pneumonia group, shortness of breath, 42.2% who had pneumonia said shortness of breath, fatigue, and cough. And you know what? COVID case 1 for me did give some fatigue. COVID case 2 gave me even worse fatigue. Shortness of breath, that came with COVID infection 1. I don't really have that long-term symptom from infection 2 because I'm on Xolair now. However, if we get some really hot days, I'm sure that it's going to be a true test, and that may even be a challenge to me. Remember, I said yesterday, I went to my sleep and pulmonary doctor, and he listened to my lungs. He said they sound pretty good. That's quite remarkable, considering back during the holidays, when I had COVID, I had to go to an urgent care because I was having shortness of breath and coughing issues, and my lungs were sounding pretty tight, according to the urgent care doctor. So, thank God I've had that improvement. But you know what? Not everybody does, because in this study, 24.7% who had COVID-19 4 weeks post-infection did have shortness of breath. All right, if you want to read this full study, I'm going to make sure it does make it over to the website. I don't know if it's going to be in the COVID section or in the flu section. Hard to say. I don't know. All right, remember that TB case we were talking about in Florida yesterday? Yeah, I have to share that with you once again. I thought this was interesting. Tuberculosis scare causes students to wear masks as they return to Fort Lauderdale School. You heard me correctly. Masks. Now, I don't know if they're using N95s. They could be using what you see in the picture here, blue surgical masks. But the point is, there's actually even an article mentioning about masks. Surprise, surprise. Yes, that I consider that to be a surprise. All right, Dennis, the COVID info guy. Some more Australia data today. New South Wales, NSW, respiratory surveillance reports, week ending of 26th of April, 2025. Notification rates impacted by school holidays in NSW. I don't know, is it their summer break? I think it's fall there now. I don't know what the school schedule is over there, but apparently I guess they're still on a break. COVID positivity rate was 3.9%. That's up by 0.8%. Number of labs reporting COVID, 4 out of 4. That's good. COVID, 835 new cases. That's down by 9.3%. But you know what? Despite that being down, I guess the testing might have gone down a little bit too because positivity rate went up slightly. Influenza, 1,432 cases, down by 24%. RSV, 1,814 cases, down by 9% at this time. All right, Taiwan we go. New COVID-19 wave hits Taiwan with 3,000 reported cases in the past week. Yikes. Looks like Taiwan is dealing with a wave, and I must tell you, that is not an indicator of what's coming here in summertime. Puerto Rico is a better indicator. I'll show you some Puerto Rico numbers, I believe from CJS, in just a little bit. Alrighty. Today, I went to a garden center / farmer's market, masked, of course, in New Jersey. And, it brings me up to a good reminder. Lyme disease and ticks. Yes, if you're going to be out there gardening, maybe you live in a wooded area. I live in an intercity area, but hey, we have had ticks before. I live on a dead-end street. CSX operates a rail line behind me, and we have had ticks before. If you follow that rail line, it takes you to a park. So, we've had ticks around here before. Chances are you may have encountered ticks in your area. Or maybe you're going to go hiking in the woods. Hey, good idea to maybe wear a hat, wear long sleeves. Make sure you're protecting yourself. And when you're done that walk or hike, check yourself. Check your entire body for ticks. Why? Ticks can be carrying diseases. And one of the most commonly known disease that they can carry is Lyme disease. And now that we're thinking about outside more and more often, if you live in an area where you know there's ticks, you want to start watching out for these little buggers. And the Centers for Disease Control and Prevention estimates that 476,000 people are diagnosed with Lyme disease every year in the U.S. Now, you could have a tick that's on you, you take it out, and you have like a bullseye. That's not a good thing. Lyme disease so many things. It can mess with your brain, can cause you to be so tired that you don't want to go out of bed, very similar to chronic fatigue. It can cause a lot of problems. You can get really sick with Lyme disease. So, yeah, you need to really pay close attention. And if you think you have it, I believe one of the ways they check for it is through a blood test. It's not easy to diagnose, from my understanding. I know my dad has had it at least once, maybe twice. He is an outdoor type person. He hunts in the woods in central Pennsylvania. I don't hunt. I won't kill an animal. I'll go fishing, but I won't hunt. The point is, he has had ticks on him before, doing so at our properties up a state on our land. I mean, I've had tick on me before in our land up there as well. I removed it right away when I was a kid. I was a Boy Scout. I went camping. Had a tick on me there, trying to remove it as quick as possible. So it's very important that you're aware of what's going on with Lyme disease. By the way, I mentioned, went to the garden center - farmer's market today. To my surprise, I was not a lone masker today. There were a few other people masked out there at the farmer's market. And if you're wondering, it was in New Jersey. Almost, I don't want to say central New Jersey, but near there. Near over there in Burlington County, New Jersey. I think it is Columbus Farmer's Market. Anywho, all right, taking a look at this. This is Texas. We don't need to look at that today. We'll look at that tomorrow because it did an update today. All right, taking a look at what is going on in the UK today, and it looks like the positivity rate chart here, and maybe it's still going up a little bit. I don't know. We'll see. Cases did go down. 1,189. That's down by 69, or 5.5%. We're not seeing signs of a big wave there yet, but I think I mentioned this most times when it comes to the UK. So many cases are not picked up. Either people just do not test, or these little buggers right here. Yeah, the at-home test. And you know what? I regret when I had my case, I should have had a PCR COVID test. There's CVS around the corner. I don't even know that they still do it. I should have just had a PCR test done somewhere, just to have it on my medical record, and to help the cause of the data issue. My case would have been counted here in the United States, so it is what it is. Taking a look at what's going on with the positivity rate, and let's see, here it is. Yeah, the positivity rate continues to creep up in the UK. Just not enough people testing. 5.34%. Taking a look at the viral activity levels in Canada. Let's see if they updated today. COVID-19 is moderate. Flu A is moderate. Flu B is moderate. RSV is low at this time. Taking a look at the website, I did do one bit of archiving today in the COVID positive archive this morning. I added Willie Nelson's COVID case. Yes, in May of 2022, he did have a case of COVID. Maybe if I ever get around to fixing all the titles and adding more cases, maybe we'll do like on this day in COVID positive history, and I'll say which celebrity had COVID during that day. Way down the line. I mean, as you can see here, it's a pretty big archive. It's growing, and I have so many different people to click on and add those dates to the titles. Yeah, it's going to make it so much simpler to see the dates of when they had COVID, or the most recent. Some people have had it several times. Taking a look at this. Birds in migration. We need to refresh this while we're doing that. I was told, now I was not here earlier, I was told our first hummingbird of the season was spotted today. Our hummingbird feeders. Hope to see more. Got some flowers today, a hanging basket that they might really like. Remember we bought that camera hummingbird feeder? Yeah, I got some bad news about that. It is not going to work. Apparently, it's just not going to be compatible. Our router's too new, apparently. It's a 5 gigahertz router, and it says router can only be 2.5 gigahertz, so had to be returned. Maybe I'll just record it with my phone if I see a hummingbird in there or do something like that. I'm going to get you a couple shorts on the channel that show hummingbirds. I promise to you. So one way or another, before the end of the season, we're going to make that happen. All right, let's take a look at bird migration. As you know, that can lead to the spread of bird flu. And let's see how many million birds are in flight today. Wow. We're getting up to 300 million. Did we get up to 400 million today? 350 million or so. And we can see almost all regions of the United States. The Rockies, not as many, and not as many in New England, but hey, birds are migrating north. Maybe you're seeing more birds. Despite bird flu, I'm sure I got some bird lovers here on the channel that just like to watch birds. Let me know down below if that's you. I like the different type of birds as well. I think they just fascinate me. All right, taking a look at what is going on with air qualities today. We do need to refresh this, and you're going to see there are some areas with bad air qualities. And hey, yeah, take a look here in the Mid-Atlantic down to parts of the Southeast, some oranges, some yellows. A lot of oranges in Texas today. Don't know what that's about. And when I was at the farmer's market today, I could smell in the air, even with masking. Well, when I first got out of the car, I could smell in the air wildfire smoke. Yeah, not a good thing whatsoever. I don't know. Are the wildfires still going in Jersey? I have not seen an update. Are there new wildfires? And take a look at this near Los Angeles. Yikes, what's going on there? I hope that's not the result of a wildfire. That's quite a bit of orange, yellow, even a red site showing up there. Alrighty, moving on. Hey, the atmosphere is going to get cleansed in the Mid-Atlantic and Northeast this week and next week. Why? Well, because we're going to have a big rainstorm. Yikes. Pinellas County, Florida, EMS calls today. Look how many sick person calls. 1, 2, 3, 4, 5, 6. At least 6 of them here, and then a whole bunch of other things. That is not a good thing whatsoever, and we do see ambulances here that are held up to the hospitals waiting to discharge their patients, meaning that the hospitals are busy, the emergency room doesn't have available bed space at the moment. Yeah, that's not a good thing. Philadelphia had 778 EMS incidents reported on Wednesday. Taking a look at what's going on in Montgomery County, Pennsylvania, few calls right now. Not terrible. It is 4:54 in the afternoon. They are dealing with 10 calls at this time. Now let's take a look at what's going on in Chester County, PA. 2 respiratory calls and just a few other things there. Not terribly busy. All right, taking a look at New York State, but I do need to refresh this. Apologies, I did not do that earlier. And wow, okay, this is a Thursday, and New York State did not go over 1,000 cases. Remind you, New York City does get added in. Now, remember, like the UK, these guys don't get added in. These guys don't get added in pretty much everywhere, the at-home test. But, hey, that's good. That's a good sign that they're dropping. Let's take a look at the hospitalizations. Are they dropping as well? Yeah, New York State hospitalizations are dropping. 668 hospitalized, 56 people in the ICU. All right, let's take a look at a few wastewater sites. But before we do that, let's pause for a second. Time for a hydration break. Today's drink of choice, water. It's a good way to keep hydrated. Gatorade's another good way. Haven't had that in a while. Juice, I drink that a lot. Not as good for hydration, but it's not bad. Hey, if your blood sugar is low or something, drink a little juice. That'll help give it a boost. All right, where should we go today? Let's just randomly go somewhere. Hope I don't make you dizzy doing that. How about we check in with Boston, Massachusetts? That's a huge wastewater site. 2.4 million population. COVID is listed at medium, dropping slightly at this time. RSV is high. A little bit of a tick upward there. Not terribly concerned about that. Influenza is still medium. Hey, influenza B, it got high during the winter wave, and it's dropping, but it's still categorized at high. HMPV, dropping but still high. Norovirus still high and dropping. Medium for hepatitis. And still some recent detections of that. Now let's go somewhere out on the West Coast, shall we? And how about we go up to, let's see what's going on here. I know I'm going to say this wrong. Snohomish, Washington. I hope I said that right. If I said it wrong, let me know down below. I've said it wrong before. COVID up here is high at this time, and you're actually seeing a little bit of an increase. So we got to keep an eye on that. Because last year, can I click on this and view last year? Let's see here. Hang on, I'm going to get this. You might see me moving myself around to the camera. But let's see. Let's go back to April of last year. Yeah, this is around the time last year. They started to rise for that summer wave. You can already see here, it looks like it's already starting to peak a little bit. But they did one of those last year. Then it went down. Then it went up again. Then it went down and gradually made its way higher. So we're going to have to keep our eyes on that. Influenza there is not much of a concern at this time. RSV, HMPV, EVD68. Yeah, we're not concerned about the other viruses there at this time. So that is some good information. All right, let's take a look at what's going on with some data from CJS. Look at that. I typed in Monday's virus update. And you know what? I like to be perfect here. Or try to. So let's type in Thursday's virus update. Oh, look at that. We spelled it wrong. There we go. I think that just looks better. So, there is some data from CJS. First off, a Monday catch-up from last week. New Jersey weekly number is 1,111 new COVID cases. 14 deaths reported by the CDC, or mentioned last Friday. Tuesday, daily number from Florida, 407 new cases. New York, 575. Puerto Rico, 191 new cases. And I did not add it here, but he does note Puerto Rico is not seen as big of a rise as other years. I don't know if these at-home tests have anything to do with that, or things are just better. And that can sometimes be an indicator for summertime. That would be a good indicator. Maryland's weekly number, 395 new cases, 12 new deaths. Michigan adds another 1,021 new cases and 31 new deaths. Not good for Michigan. Neither is Virginia. 1,088 new positive tests and 11 deaths. Florida, daily number, for Wednesday, 169 new cases, 10 new deaths, 3 from 2024. Never ceases to amaze me how states can pull a rabbit out of a hat and find cases from previous years. New York, daily number, 664. Puerto Rico, 144 cases. Hawaii, 197, weekly number. Nevada, weekly number, 295. Washington, 239 emergency department visits and 5 new deaths. And I must mention, Hawaii is another one we'll have to start watching soon, as is California. Generally, anything to the west, including Hawaii and Alaska, we have to watch to see what happens there for the summer wave, because last year, those were one of the areas that started first. Alrighty, folks, that does it for the Thursday edition of the Virus Update. If you enjoyed it, give it a thumbs up. If you're new to my channel, subscribe down below. Help me reach 10,000 subscribers. Share this video with anyone you know. That's a great way of doing it. And, of course, hit the notification bell and leave any comments in the comments section down below. I will see everyone again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Thursday evening. Thanks for watching.